Good morning, ladies and gentlemen. The prevalence of depression and its associated factors among the primary caregivers of patients with psychiatric illnesses attending psychiatric clinics in Hambantota district. Being diagnosed with a severe psychiatric illness is a life-changing event not only for the patient but also for the whole family. Long-term caregiving of the patient with severe mental illnesses require great dedication. It may lead to compromised physical, psychological, and social well-being of the caregiver. Global studies show that the caregiver of the patients with severe mental illnesses have higher rates of depression when compared with the general population, usually two times that of the general population. There were only 2 studies done in Sri Lanka on caregiver strain and the depression in major mental illnesses. One of the studies was carried out in urban setting, including 85 caregivers, that is in National Hospital Sri Lanka. And this study showed that the symptoms of depression were significant in 37.5% of caregivers. Aim of our study is to estimate the prevalence and associated factors of depression among the primary caregivers of patients with schizophrenia, bipolar affective disorder, major depressive disorder, attending psychiatric clinics in Hambantota district. This study was conducted as a descriptive cross-sectional study, and there were 14 psychiatric clinics in Hambantota district. Only 12 clinics were functioning at the time due to the health policies during the COVID-19 pandemic. And these were the clinics we gathered data. 12 clinics. 180 caregivers who fulfilled the inclusion criteria recruited to the study. Caregivers were interviewed by trained data collectors with an interviewer-administered questionnaire for demographics, socioeconomic standings, patient illness-related data, and adverse effect on caregiver due to their role. The questionnaire was developed by the principal investigator using previous studies after discussing with relevant experts. GHQ-12 and PHQ-9 were used as the last 2 items of the questionnaire, and so the caregivers were screened for psychological distress with GHQ-12, and those who became positive for GHQ-12 were again assessed with PHQ-9 for depression, and those who became positive for PHQ-9 were clinically assessed by a consultant psychiatrist to confirm the diagnosis. Results. In patient population, a majority, that is 69% of the patients had the diagnosis of schizophrenia, followed by bipolar affective disorder and major depressive disorder. 51% of caregivers were female. Caregivers' age ranged from 18 to 81 years, and the mean age was 55.5 years. 87% of mentally ill patients and 50% of the caregivers were unemployed. And 58% had their monthly family income between 5,000 rupees to 25,000 rupees. And in 15% of the families, monthly income reported to be less than 5,000 rupees. 45% of all caregivers admitted that they need psychological support from someone, and 90% were dissatisfied with the financial and other supports received from the government. However, 94% were satisfied regarding the care they received from the local mental health team, and 74% of the patients did not have any admission to psychiatric facility during last year, and 84% had good overall medication compliance. The prevalence of depression among the caregivers of the patient with severe mental illness was 19.4%. It was revealed that the female gender, older age, presence of physical violence, and beetle chewing were associated with caregivers' depression. Female gender, age above 50, beetle chewing, independently predict caregiver depression following binary logistic regression analysis. Conclusions. The prevalence of depression is high in caregivers of patients with severe mental illness. 1 in 4 female caregivers found to be depressed. Female gender, age above 50, and the beetle chewing independently predict caregiver depression. The findings of our study were comparable to the finding of the studies conducted in Ethiopia, Saudi Arabia. However, the rates are lower than China, India, and USA, California. This study illustrates the importance of screening of caregivers for depression. A special focus should be given to the primary caregivers who are above 50 and female caregivers. There's a necessity for the development of social support services to ease the burden of the families with mentally ill patients in rural Sri Lanka. There are some limitations of our studies. Our study is a cross-sectional study, therefore it's very difficult to establish a cause-effect relationship. The study was carried out during the COVID-19 pandemic of Sri Lanka. So obviously the financial and social effect of the pandemic might have played a role. Therefore, I have to be cautious when we are generalizing the results. There are certain strengths in this study. Unlike most of the studies, outcome measure of our study is the clinical depression established by a consultant psychiatrist. Moreover, this is the first study to look at the caregiver's depression in Sri Lanka in a rural setting. Certain factors surface in this study, such as high unemployment rate of the patient and the caregivers, the high dissatisfaction rates towards the government supports, sends a strong message to the policymakers. Thank you very much.